Today, we're going to talk about something really important: addiction recovery. We're going to get into why that one-size-fits-all approach so often falls short, and how a plan that's actually built for you can make all the difference. If you or someone you care about has been through treatment, this question might hit pretty close to home. That whole cycle of going into a program, feeling like you're making progress, but then relapse isn't far behind. It is so frustrating, and it can leave you feeling like you've failed. But what if the problem isn't you at all? And here's the thing: you are not just a number on a chart. Your life, all your experiences, your own biology, the reasons you're even looking for help, that's all yours, and yours alone. So expecting some single standard treatment to work for everyone, it just ignores that basic truth. Okay, let's dive into the science behind this, because personalization isn't just some nice-sounding buzzword. It's actually a real, evidence-based necessity when it comes to effective care. This isn't just a feeling or a hunch. It is a scientific fact. Study after study confirms what a lot of us already know deep down: every single person responds to treatment in their own way. What works like a miracle for one person might do absolutely nothing for someone else. So there's a scientific term for this. It's called heterogeneity. It sounds complicated, but really it's just a way of saying that we are all incredibly diverse. Our symptoms, our life stories, and what we actually need to get better, it varies so much from person to person. And I love this analogy because it just perfectly captures the shift in thinking. The old way was like handing everyone the exact same generic paper map, right? It doesn't matter where you're starting from or where you need to go. But the new approach? It's like a personalized GPS. It knows you, it knows the challenges ahead, and it finds the absolute best route for your specific journey. And you can actually see this in the data. What we're looking at here basically shows the outcomes for a whole bunch of different people. Each one is an individual, and for some, one type of therapy was way more effective. For others, a completely different approach worked better. The takeaway is just so clear: matching the right person with the right therapy can literally be the biggest factor in their success. So that's the science. The big question is, how do we actually do this in the real world? Well, there's a pioneering center called RecoveryCNT that has built its entire way of doing things around this exact principle. It all started with Dr. Indra Sidami. She's a double board-certified expert in addiction medicine, and she saw that revolving door of traditional treatment firsthand. So she founded RecoveryCNT with one really powerful mission: to make truly effective, personalized care accessible to everybody, without making them put their entire life on hold to get it. And this is where things get really different. Think about it. Traditional inpatient care asks you to literally stop your life. You have to leave your job, your family, your home. But RecoveryCNT's outpatient model does the opposite. It weaves treatment into your real everyday life. This means you're building recovery skills in the exact same place you'll need to use them, which leads to a recovery that actually sticks. So this isn't just about changing the location of treatment. It's a completely different philosophy, and it has a huge, real-world impact on your life and your chances of success. So what does this actually look like for you? Well, it means you can keep your job. You can be there for your family. It means you're learning to handle those real-life triggers as they happen, with support right there with you. And maybe most importantly, it means your loved ones can be a real part of the healing process, right from the start. And you can really hear the difference this makes. The impact on families is just huge. Like one family member, JR, said, "The program's outpatient approach allows more family involvement, which helps in recovery. That integration, it's everything." And that personalization, it goes even deeper. Instead of these huge anonymous groups, RecoveryCNT keeps the settings small and intimate. This means the therapists actually get to know you, your story, your struggles, what you need, so they can build a treatment plan that is truly customized for you. And that feeling that you're being seen as a person, well, that changes everything. Just listen to what alumna Brandy B had to say. "CNT saved my life. The staff and therapists cared for me as a person, not just an addict." That right there is the heart of it all, seeing the person, not just the diagnosis. So when you put it all together, the takeaway is pretty clear, right? A generic plan just isn't going to cut it. You deserve a path to recovery that's actually designed for you, one that respects your life, your challenges, and all of your strengths.
Which brings us to the most important question of all. After hearing all this, after seeing the science, are you ready to stop trying to squeeze yourself into a system that wasn't built for you and instead find a plan that's built to fit you perfectly?
And if the answer is yes, please, please know that you are not alone in this. Help is right there, and a personal, compassionate plan is just one call or a click away. You can reach out to RecoveryCNT at 1-732-484-9661 or visit their website. Your story is unique. You deserve a plan that is too.